Hey everybody, we're back. Our next question, I just had a baby. They said I had to wait to get health insurance for my baby, that I couldn't get health insurance for my baby. I did not understand what I was being told. My friend told me to email you. Good question. Again, I've talked about that quite a bit, and I'm happy to answer your question. I hope you're listening. The answer is that I'm going to guess here that you didn't have health insurance, because if you had health insurance, then they're going to, just a paperwork shuffle, allow you to add the baby on immediately. If not, they're going to make you wait 30 days. Sometimes it's 35 days. Again, I'm not an expert on every insurance company in the country, but there's a waiting period. They want to make sure that the baby was born 100% healthy, and I'm sure that the baby was. They're also going to ask you for a pediatric statement from the pediatrician statement, just telling them that the baby was born 100% healthy and sound. So don't worry, as long as that's the case, you'll be fine. You'll get health insurance on the 35th day or the 31st day, but everything will be fine. Next question. Andy, like the show. Thank you. What kind of insurance do you have? I'm really curious to know. Good question. I have a wife, a beautiful wife, a lovely wife, and 3 children, lovely kids, love my kids. Hello, kids, if you're listening. Hello, honey. But anyway, the answer is that I'm 50 years old. I have a higher deductible. I can pay $800 to $900 a month for a low deductible, or I could pay what I do pay, about $325 a month, for a higher deductible. We're on a $5,000 deductible. Now, it sounds a little scary, I know, but it's not, because it's not $5,000 times 5, which would be exposure of $25,000. My maximum exposure for the 5 of us is $10,000. So I choose to save that $500 a month or $6,000 a year, because $6,000 covers the $5,000 deductible. Excuse me. So there's no assurance that I'm ever going to have to dip into my pocket. Now, as I mentioned, I've hurt my shoulder recently. It'll be fine, but the point is, yeah, I got a bill. My daughter hurt her wrist. I had to go to a lot of casting and so on for the wrist. She'll be fine, but again, I get billed. My son had a terrible flu in the last, I'll say, 3-4 months. His fever spiked. Would not take any chances. Rushed to the emergency room. Yes, I got a bill. So not a great year for Andy when it comes to the deductible, but I'm more than happy to pay it, because I don't want to pay an extra $6,000 a year, year after year after year, because I have a $5,000 deductible. It wouldn't make sense. And the key again is the max out of pocket. Everybody, that's the key question. Also on my plan, so I can be very specific here, we get doctor visits, copay, medication, copay, urgent care, not emergency room like we've talked about, urgent care. We go to the one in the book, copay, gynecology, copay, preventative care, copay. So I can live with that plan. I'd rather spend $325 than $800, and we're covered for what I always say, God forbid. Next question. Andy, I've had insurance for 20 years in the company I work for. Now I am in Nevada, and I've been declined. I am sick about it. I am not 65 years old. I am not eligible for Medicare. I have many health issues. I think I may have to go back to Colorado. Any advice? That's a tough one, and I'm sorry for that. Again, we talked about flaws in the system. It's unfair. Now, when you left your company, they should have offered you something called COBRA. See if that COBRA is still available. I hope it is for you. Get that COBRA. It may be a little more expensive. It's going to be more expensive than what you were paying, because I'm sure the company was chipping in at least 50%, usually. But find out. I hope this is a recent occurrence and you're within that 30-day window. If you're not, we do not have a high-risk pool. Many states do, many states don't. That means that you get guarantee issue. So after that, we run out of ideas. Many health issues, you were not specific, so I am concerned. You're welcome to email me your phone number, again, andyross@cox.net, and I'll give you a call and we can talk about it. You know, maybe you have a spouse that's working here or will be working, and she can add you on. I'm not sure of that. That's an idea. Maybe you get a part-time job, as painful as that sounds, but that is a solution if they offer you benefits. Or in the worst case scenario, I understand your plight. I don't know. Maybe it is moving back to Colorado. Again, a flaw in the system. It's unfair you're being penalized, but the saving was the COBRA. You get the COBRA, you're on COBRA for 18 months, and then I can insure you, no matter what your health conditions are, no matter what, guarantee issue, you are going to be covered till you reach 65 in Medicare. So here, those are some ideas. Email me, and we can bat some more around. There's not that many more than I just mentioned, and I understand your upsetness. Andy, is asthma considered a pre-existing condition? I do not have health insurance, but I do have asthma. The answer is yes, absolutely. Allergies are too, if you take medication. So you'll be rated up. Make sure you don't get an insurance that puts a waiver on it. There's waiver insurances, and then there's rate up. I'd rather you be rated up, charge a little bit more, pay a little bit more per month, but have that inclusiveness. I'm sure you're on either Singular, Advair, or Albuterol. You didn't mention your medication, but the answer is yes. Asthma is a pre-X. You'll be rated up. Whatever the percentage is, they'll go over that with you. I hope that is the only pre-existing condition. Again, if budget is a concern, go with a higher deductible, better starting point. I'm going to try to sneak in one more question before we run out of time today. Why do women cost more than men? Aren't men more reckless? You're probably right about the reckless part. The reason why women are more expensive is because they have their yearly exam. Those yearly exams multiplied by the women in the country, multiplied by, it's big dollars. So anyway, we're done. I wish everybody a very safe and great week. We'll see you next week. God bless, and thank you.
Aging medicine.